you thought that's a ghost and that's actually not.
Yeah.
So that's probably just you having your hair like.
This problem, like, what should I do? And I'm like, okay, no, like, let's just take a step back.
Otherwise, you just follow the sun.
Yeah.
Just follow this.
Me, like, if I can't sleep and I get out of bed, then I'm definitely awake for the rest of the night, right?
All right. Hi, everyone. I'm Dr. Deb, and we're so happy to have Dr. Nishi Bhopal. She's a sleep physician and a psychiatrist. And today we'll be talking about how sleeping disorder and insomnia and all those things that will relate to your daily life. So thank you. All right. Would you kind of give a little bit intro or something?
Sure. Well, thank you so much for having me. I'm really excited to talk about sleep today, my favorite subject. So I'm Dr. Nishi Bhopal, as you said. I'm a psychiatrist. I'm a sleep medicine doctor. I'm based here in the Bay Area as well, but I have a telehealth practice. And we see patients all across California with depression, anxiety, and sleep issues. And, we take kind of like a more holistic, whole person approach to it. We were just chatting a little bit about, do we use medications and things like that? And, medications can be a support, but for sleep, you can actually heal people with restorative sleep in a very a natural and holistic way. So I know we'll talk about that today.
True. All right. So, like you said, you usually do like a holistic way. And so like in TCM, we also see people as a whole and as how we diagnose, with a person that first come to me, no matter they come in for pain or digestion or stress, I always ask about how's their sleeping pattern is. And do you do pretty much the same? How do you, of course, people come in mainly for sleeping, but how's your, how do you work with?
Yeah, definitely. So, we really like to look at all the different aspects of what's going on in a person's life. Mm-hmm. So, of course, we start with whatever the symptom is. So sometimes people will come to us for insomnia specifically, but my practice is also a psychiatry practice. So we do see people who have anxiety, depression, and that does often come along with sleep issues too, or even fatigue. So first we like to just kind of get a sense of what does that look like in their day-to-day life? Mm-hmm. Like how is it impacting their functioning? How is it impacting their relationships, their work? Then I like to get a good sense of what does their daily schedule, like what time do you have to get up, start work? What do you eat in the morning? What do you eat throughout the day? What's your activity levels like? What's your stress levels like? What medications are you taking? What health issues do you have? So it's really looking at the whole person, and I think one of the mistakes that I see a lot with sleep treatment, especially in the allopathic, very conventional medicine model, is immediately in medicine, the treatment plan is just based on the symptoms. So it's like you have the symptom, let's give you this medication without zooming out and looking at the whole picture. So that's kind of what we like to do. Yeah,
it's pretty similar to Chinese medicine because with Chinese medicine that's related to sleeping, it's related to our different organ systems. So our heart, our liver, our kidney energy and spleen energy, which is with heart and liver, it's more related to the mood. And then the kidney energy is more related to, some are more related to age. And then the spleen energy is more related to digestion. So with people if you have a full meal, right before you go to bed, of course, you're still digesting, you can't sleep well. So all of these, we need to know which is which. And also the sleeping pattern, it's either they can't fall asleep or they'll wake up early and some can fall back to sleep again and some could not sleep anymore. And those are the ones that tell us different information and that will change how we think of which falls to the root of it, and then we'll treat it by that. Yeah. So I think is that pretty much what you guys do?
Yeah, and it's so interesting too to hear that because I think there's so much wisdom in TCM and then Ayurveda as well, which is the healing from India. And a lot of these ancient systems, they have a very sophisticated understanding of sleep that aligns with the modern view. Mm-hmm. So in the modern view of sleep, we know that sleep looks qualitatively different in the first half of the night and the second half of the night. Mm-hmm. So if someone is having more trouble falling asleep, and if it's more issues in the first half, that leads us to a certain type of diagnosis or a certain type of investigation. And then if the issues are more in the second half of the night, they're waking up, they're having trouble going back to sleep, that type of sleep looks very different because we get more deep sleep in the first half, more REM sleep in the second half. So that comes with a whole other set of sleep disorders that are more likely to happen during that time. And so that leads us down a different pathway as well. So that's why it's really important to understand, you know, if you are struggling with your own sleep, or if you're a clinician working with someone with sleep, really understanding like, what does it look like for them? Because insomnia is not always insomnia.
Yeah.
Other things can look like insomnia.
Yeah.
Right? Insomnia is a symptom. It's not necessarily a diagnosis.
Yeah, so like by different patterns of sleeping, usually how do you guide to change their lifestyle, or how do you help them from?
Yeah. I think it really depends on that individual, because sometimes it is a lifestyle problem. So for example, I saw a patient yesterday, and he's definitely not getting enough sleep, and it's having an impact on other areas of his life, trouble with focusing, doesn't have the energy to do other things he wants to do. And he was like, well, just tell me what mattress to get. Like, if I was going to spend dollars at this problem, like, what should I do? And I'm like, okay, no, like, let's just take a step back. I'm like, it starts with lifestyle. Let's make it a priority for a lot of patients that I work with anyways. Like, we're both here in the Bay Area, right? So we see these high functioning patients, IT people, engineers, they're working all night, they're on their computer, and they're not making sleep a priority. So that's the first thing, is like, how do we make it a priority? Because it is the foundation of everything else that you do in your life. And we could talk about cognitive performance and memory and things like that, why sleep is so foundational. But we start with that. But there's also medical things that can come. So for example, in women, many women have low iron levels. And so a low ferritin level, less than 100, can contribute to restless sleep, restless leg syndrome, and even restless sleep. So that's something that we look for. So we do labs in our practice to see, is there some other micronutrient deficiency that could be contributing? Diet, you mentioned, right? Are you eating a heavy meal before bed? If you're not getting enough fiber, there's actually some data showing that diet with less fiber and too much processed sugar reduces deep sleep. So these kinds of things we look into as well. And then a big thing is sleep apnea. A lot of patients have sleep apnea and they don't realize, and that can look like insomnia. So that's something that we...
I tried the CGM 2 years ago, and then at that time I was on diet and exercising a lot, and then I found out that I didn't have my phone with me because I don't like to be waken up with that. So, but I do know like what time I woke up, and then the next morning I check with the phone. Oh, I had my blood sugar level was too low at this exact time. So that really just gave me a click. Like I asked the dietitian at our hospital, and she said, just have some milk before you go to bed, and then at least that will have your blood sugar level to be balanced. And then after that, I didn't wake up anymore, and the blood sugar was pretty steady, and that was interesting. So yeah, it's like we're talking about like tracking our sleeps, and I believe you also have patients coming with you that telling you that they've been tracking their sleep. It tells them they have a good score, but still they feel tired. And what do you think about these kind of symptoms?
Yeah, it's such a Pandora's box with tracking, because it can be helpful, but it also can be harmful. Like I also use an Oura ring. I'm not wearing mine right now. I'm taking a break because I think it's a good idea to take a break from those tracking devices once in a while. Where they can be useful is it can give us insight into behaviors that impact sleep. And, for our clients, patients who might not be making it a priority, or they don't realize that alcohol is negatively in sleep, or that espresso after dinner has an impact, they can see the actual data on the tracker. And so it helps them make behavioral. So I've used it in that way with patients where they're like, oh yeah, that glass of wine actually is not helping me, even though I thought it was. It's useful in that way. But we have to be careful with interpreting the data, because these consumer grade trackers, they have a proprietary algorithm, so we don't know actually what that sleep score is based on.
Yeah, I read something, and they said like they checked like from Oura, from Apple Watch and others, and they find that it's not really accurate. When they think it's light sleep, they're probably awake, and they think that it's in REM sleep, but it's not. So probably it's
That's exactly right. And you actually cannot tell what stage of sleep somebody is in based on their consumer grade, because those sleep stages, REM sleep, deep sleep, so basically there's stage 1, 2, 3, and REM sleep. Those stages are based on EEG brainwaves. We're not measuring those with a watch or a ring.
So
right?
that's why I'm I'm so wondering how do they test this when when they track it. Yeah.
So I actually don't even look at that data. So I'll have patients come to me who say, oh, I only got 10% REM sleep, or I only got 5% deep sleep. Don't even look at that. Like, I don't even use that because it's a useless kind of metric.
Yeah.
What I do like to look at is the metric. These wearables are good at tracking how much sleep somebody got. So I like to look at sort of the duration, but even more important than that is the pattern. So like, what is your sleep regularity like? That's actually more impactful on health than sleep duration. And studies do support that. And then I also like to look at their heart rate variability. And that's a good marker of stress resilience. So if we see that going down and their sleep duration and their regularity is going down because of certain lifestyle or other behaviors, or maybe it could be they started a new medication and we can see that reflected on the data. Or maybe they're pregnant and we can start to see some of those changes. So it's useful for kind of a holistic overview, but I don't get hung up on the individual metrics, the sleep score, the sleep stage. Those are not really that useful.
This is really good information because like for most people, they don't really know what it means and they only focus on the score because it's easier to understand. So now that you put it out there, that means a lot. Yeah, and I know there's so many people are so hooked up on it and they even give them even more stress. Like they couldn't go back to sleep because they're worried about if I can make it tonight. And I also have patients coming and they say, my tracker told me I sleep well, but I asked them, so do you feel like you sleep well? It's like, no, I still feel tired. It's like, yeah, so don't really trust on it. And when I check their pause and check their tongue, you don't, from the pause is like, it's a mess. They're really under a lot of stress and maybe they feel like the watch maybe feel like they sleep well because they really have a really long period of sleeping, but not really the quality is not good enough.
Exactly. And for people who get hung up on the scores, on the tracking, I do recommend taking a break because you don't really need a sleep tracker to know how you feel, right?
Just track by yourself.
Exactly. So I'm a proponent of like tune back into your body, tune into your intuition, listen to your gut, listen to yourself, how you feel. And the tracker can be useful for certain things if you want to get some insights, but it's not we're not trying to make the tracker happy.
True.
You know what I mean? Like it's like we're not trying to live for the good metrics. Like we just use that as data, but we can put it aside as well. We hold it lightly.
Yeah, that's the best way to use it. And what else should we?
Maybe we can talk about
Ayurveda or
or do you want to talk about like?
Sure. Yeah. Okay. So. As a sleep doctor, what would you recommend people? Like how good is like a good quality sleep? How long should they have? And do you?
Yeah, so I think a lot of people have heard that you should get 8 hours of sleep or somewhere between 7 to, and I think that it's helpful to have that sort of duration in mind, but it's also important to remember every person has their own individual sleep need. So your needs might be different than your partner or your friend, who's also the same age, right?
Yeah.
So like we all have different, it's almost like everyone has a different shoe size. We all have a different height.
Yeah, I always tell my patients, it's like the battery length. Some they just need like a quick charge and then they're all fully recovered. And some they take a little bit longer, but they still get there.
I love that analogy. It's so good. And, and so that's important to remember because sometimes, again, like with the patient population that I work with, sometimes people get really anxious that they're not getting enough sleep. Like I'm only getting 6 hours, but I think I need 8 hours. And so a lot of this information that's out there, like even the National Sleep Foundation says adults need 7 hours of sleep. That's based on sleep opportunity. That's how much time you should be in the bed. But on average, like there's going to be outliers on either. So some people are fine with 6 hours. And especially with age, those sleep requirements go down. Teenagers need more. Teenagers need 9 or 10. So I think it's also very important to remember sleep fluctuates from night. And where I see people getting anxious is if they have one bad night of sleep, now they're really frustrated, right? They're really anxious about it. And the reality is that that's how it is. Some days you're not as hungry. Some days you're hungry, right?
So how do you say, like, if they just have one night or 2 nights of, like, not a good sleep, how would you diagnose as insomnia? Like, how long will this happen until you say, okay, you really have insomnia?
Oh, that's such a good question. So insomnia it's defined as difficulty falling asleep or staying asleep at least 3 nights a week for 3 months or more.
Okay.
And it also needs to be associated with daytime impairment. So that's another factor that needs to be there for an insomnosis. What we see with insomnia is that now it's become its own self-perpetuating thing. So it's not just the person is not getting enough sleep, but they're worried about it. And now they're trying even harder to fix it. So you see a lot of sleep effort, right? And you probably see this in your patients as well. Like they're trying melatonin, magnesium, ashwagandha, all the things. They're trying everything, right? Maybe sometimes medications, maybe sometimes using gadgets and all the trackers and all this. So now they're putting so much effort. And the thing with sleep is that the more effort you put into it, the more it goes away, the more elusive it becomes, like a cat, right? There's that quote, sleep is like a cat. It only comes to you when you ignore it. Yeah. It's very much like that.
So just relax. Yeah. Just relax. Yeah, like when you were talking about that, it was just reminding me, my dad, he's almost 80, and then his other, like my dad can just fall asleep right away, no matter where, when, whatever. As long as he's like having some time, he goes to bed and then he can sleep, or on the bus or whatever. But then his buddy friends, like all in their 70s, 80s, and they're like, I envy you so much. How could you just sleep like that? And he's like, but we were having a meeting and you were sleeping. And he's like, probably you were sleeping during watching your TV or in the afternoon, so you already have those like
little micro sleeps.
Yeah. So that's why you don't need to sleep at night. Right. Yeah. So it really depends. And yeah, so like when I ask my patients, I'll ask like, do you take a nap? Like as Chinese, we like from when we were in kindergarten or like in elementary school, we'll always have a nap after lunch break, and that just gives us a little bit boost in the afternoon. So like with Chinese, I think the napping it's a good kind of like just to have that extra energy for later the day, and that's a good thing.
And napping it's part of our natural sleep cycle. So for the circadian rhythm is our alertness signal that we have during the day. So sleep is governed by 2 processes. One is called process S, which is like so the longer you're awake, the more you have sleep pressure or sleep drive builds up. And the second process is process C, or circadian. And that's our alertness signal. So when, as the morning goes on, that alertness signal goes up, and then there's a dip around 2 or 3 p.m. and then it goes up again. And that's why we see in many cultures there is a nap, like even in like Spain, these type of countries, they have a siesta. But we've lost that I think in our Western society here. Like the
modern lifestyle right now.
And it's okay. Like sometimes people will, like we have patients in our sleep insomnia program, and like they get so frustrated that they have this dip in the daytime. Why am I sleepy then, but I don't feel sleepy at night? And it's because that's just the natural rhythm. And same thing at 2 or 3 a.m. A lot of patients that we work with insomnia, like they're so frustrated that they got up, every morning at 2 or 3 o'clock in the morning. And that's also part of our normal sleep cycle.
Yeah.
And it's actually an evolutionary thing, because if we think about when we lived out in the tribes, it would be advantageous to wake up in the middle of the night, make sure there's no tiger attacking the village, no intruders coming to attack, right? Survey your surroundings for safety, make sure the babies are still breathing, right? And then you go back to sleep. So that actually is built into our evolution. But in our modern world, we have lost touch with these natural processes.
Yeah, I think the natural process is really important. Like in TCM of talking, it's like we know the yin and yang. If you see the picture, the yin is the black side, and then the yang is the white side. So everything is when the yin goes towards yang, that's when the moon is coming up, the sun is going down. So that's when you need to go to bed. So when people think that when people can't fall asleep and we check their symptoms, sometimes it's because their yang energy is too excess. So we need to boost the yin energy and just have it to going back down. And we also need to calm the mind. So that's something we need to do. And like when you're saying like waking up during the midnight, that's because that's when the yang energy is coming a little bit rising up. And that's why some people having like if they have yin deficiency, they can't suppress the yang energy, they'll wake up at that time. So we also need to adjust that energy. So that's pretty much like, that's how like Chinese medicine is about. It's all about like related to the whole nature. And then like we suggest people go to bed earlier during winter time because the sun goes down earlier, and then like waking up earlier in summer because the sun comes up earlier. So as the traditional Chinese medicine, they'll tell you like for longevity wise, you just follow the sun. So just follow the seasons. Yeah.
Yeah, I love that. And it's very similar to Ayurveda. That it's very much about the day-night cycle and aligning with that and aligning with the difference. So so interesting.
Could you talk more about Ayurveda? How does it see like how sleeping is work? How does Ayurveda treats sleeping patterns and all that?
Yeah, definitely. So I'll just preface it by saying I'm not an Ayurveda expert. There's other people who have much more expertise on that topic than I do. But the basics are that it's very much about like there's a phrase called dincharya, which is about your daily routine. So having good sleep starts with your daytime. It's not just what's happening in the night. So it's about rising with the sun, getting that bright sunlight exposure in the morning, starting your day with hydration, having your meal, your largest meal when the sun is at the peak. So midday meal, that's when your digestive fire is strongest. Then, kind of winding down as the day. It's also thought that sleep problems arise from imbalance in vata, which is like excess of like air and ether energy. So it's like dry and people get anxious. So you think about the racing mind, that's an excess energy. Also pitta energy. If there's too much fire, that can also create some difficulty with staying asleep, right? And that can
is
be emotional.
So related to Chinese medicine, like you said, with the vata, with the anxious mind, that is our wood energy, the liver energy. So when the liver energy is excess, people have like, they can't, I also ask like, do you dream a lot? And that's related to like, they think too much, and that's related to the liver energy. And then with the fire, when like the heart is related to the fire energy. So when the heart fire is excess, it's also will that like people to have insomnia.
So interesting. Yeah.
You can keep going on.
Yes, no, definitely. And I think like tying it back to modern science, like how do you make sense of it? There is a framework in Ayurveda where they kind of break down the causes of insomnia into 4 main categories. And I think it's a very relatable framework for modern medicine. Like I even teach this, like I teach other doctors about sleep. That's one of the things that I do. And I teach this, and basically it's FEEM. So food, environment, emotions, medical. So food is not just what food you're eating, but also the time that you're eating. And we about that, not eating too close to bedtime and things. Acid reflux, those types of things that cause too much fire, that's in the food category. Environment is like simply making sure that your room is not too hot, like keeping a cooler environment, that you're getting darkness at night, you're getting brightness during the day, that you have a comfortable, safe place to sleep. I think sometimes people forget about the safety.
That's when I think about like the feng shui. Like we talk about, you need to have a safe surrounding, and like as Chinese, we go into the bedroom, we'll look up where the bed. Well, I'm not that into like which direction the bed is, but like for just the simplest thing is like we don't want like a mirror facing the bed. And that's because if you wake up in the morning, in the middle of night, and you see someone like you thought that's a ghost, and that's actually not. So that's probably just you having your hair like all over, or like we don't like there's a beam just on top of your head. That's bad in feng shui as well, and because that gives you like a pressure when you sleep.
Interesting.
So that's like when people go shop for a new place for a home, and they'll look at where the bedroom is there a beam up top, and if there's a beam, they'll just probably just kind of cover it just by decoration, they can just make it a false ceiling just to make it even, so you don't have like the pressure kind of. And that's just feng. Actually, it's not like any hocus pocus.
Yeah.
It's definitely the reason for that feng shui.
Yeah, it's so interesting, and there are, again, I'm not an expert in this. There are like aspects in Ayurveda that are also about creating that environment, so it's conducive to the energy flow. But yeah, so definitely like the environment is one piece, and tying it back to what can the average person do. One thing is like, don't have clutter all over the place in your bedroom, right? Make sure it's like clean. Vacuum it so there's no dust. Like, you don't want a pile of laundry in the corner, because then your mind is thinking about your to-do list, and your bedroom should be your sanctuary. So those are the environmental. Then if your partner is snoring next to you, that's also a thing, right? So like, or your cat or dog is on the bed. So thinking about how can you make it more comfortable. Then the next E is emotional. So this is addressing anxiety, panic, trauma, depression, stress, all those emotions that come up at nighttime. How can we deal with them during the day so that they're not being ignored or suppressed during the day? Now, nighttime is when you have white space and all that stuff comes out, right? So it's about navigating that during the day. Then M is medical. So medical means any medical condition. So like sleep apnea, restless leg syndrome, narcolepsy, but even non-sleep disorders, thyroid events, all the other medical things that can be contributing, things like that.
It's very interesting. So like, you said you use, how do you guide your patients? Like, they don't need to take any medication, and usually how long will see the results from your help?
Yeah. So in my practice, we specialize in insomnia specifically, because I know there's other sleep disorders as well, but insomnia is our main focus. And how we help them is through a combination of something CBTI, which is cognitive behavioral therapy for insomnia. And that is the gold standard recommended treatment for insomnia. So it's recommended by American Sleep Medicine, American College of Physicians, and it's so effective, and it's not a medication. And people get good results over time, like long-lasting results, versus medication only works when you take it, right? So we use combination of CBTI with ACT, which is acceptance commitment therapy. So why we do it that way is because the ACT piece is a lot more gentle. Sometimes with the CBT piece, there are some aspects of it that can feel rigid for some people, like reducing the amount of time in bed, getting out of bed if you can. And like, I know for me, like if I can't sleep and I get out of bed, then I'm definitely awake for the rest of the night, right? So we've created a more gentle approach to it. And what we have found is we've had patients go through this program with severe insomnia, like 20 years of trying everything. Some of them have even done the normal CBTI protocol before, and then within 2 or 3 weeks, right? And like, you get your life back when you're able to sleep. Yeah, and then we also bring in some of the things we were just talking about, like how do we support your nervous system? How do we nourish your body? So we bring in those aspects.
But like, so you don't really give them like, as your Ayurvedic background with your studies, do you introduce them to anything, or is just something that you study?
Yeah, I mean, a lot of times, so like as a physician too, I will get consultations from other doctors where a patient might have more complex situations. So they might have bipolar disorder or PTSD, and they're on medication. And in some rare, I'm not opposed to using medication. I'm not anti-meds at all, because there's a role and a place for them. They're just not helpful for long-term insomnia. And actually the data does not support their use for long insomnia. But medications can be useful for like a couple of weeks, just to get people back on track, give them some support, especially if there's other on, like they're having a depressive episode or something. So there's a role for that. And then in terms of like bringing the Ayurveda piece in, we will talk to them about like, sometimes there's a role for supplements. There can be a role for melatonin, for example. It's not a sleeping pill, it's a circadian regulation agent. Sometimes we'll use ashwagandha. Sometimes we'll use things like magnesium or other supplements as a support. But I think the mistake that I see a lot of patients making is that they'll take that thing hoping it's going to work for them like a Ambien, right? Yeah. It doesn't work that way.
And sometimes they don't even need it.
Exactly.
And it's just because the commercial or they go to the drugstore or Costco, or they see, oh, these all are good for sleeping. They think that they need it, but actually they don't.
Yeah. And that placebo effect is strong. Yeah. Right? Like they take it and they're like, oh, I slept great. And it's like, well, okay. because you believed it was going to work for you a lot of times.
Yeah, but that's a good thing if it works. But sometimes they hope it works, but it didn't, and then they'll be even more frustrated. And
that's exactly what it is, because that's the vicious cycle of insomnia, where someone is not sleeping well, so now they're putting more effort. So, it's really important. So for anyone who's listening who's struggling with insomnia, it's important to recognize that all of these things that are available, it's not that they're bad. Like, there's a role for magnesium, melatonin, all these things, but how we use it is very important. And they are a support, but they're not a solution, because our body knows how to sleep. It's just that it's almost like, if you think about, if you're hungry, but you're also nauseous, you don't feel like eating. So if your body needs to sleep, but your nervous system is
still awake,
dysregulated, it's awake, you cannot sleep, because that nervous system is saying that you're not safe, and sleep is vulnerable. So we have to calm the nervous system so that your body can feel safe, and then sleep will come.
Yeah, so like usually we'll teach, like with acupuncture, we'll use some points like to calm the nerves down. And like for people that are really nervous, I usually teach them to press some points. One is just in the middle here, on the palm line, just in the middle, and then one is just next to it. And these two helps a lot. Or just like do some massages on the head. And like in TCM, there's so many acupoints on the head, and if you don't know where, it's okay. You just kind of like massage, and then that will just if you massage it, you'll find that, oh, my scalp is so tight. Like my partner, she works a lot, and then usually like when I give her a little bit of massage, she's like, oh, this is tight, this is so tense. And then afterwards, if I massage it right, and then she's like, oh, that really feels good, and then she sleeps like a baby. So like for people that feel stressed out, and like if you feel like you're having a very anxious day or very tiring, but your mind is still going along, just give yourself a gentle massage, and that will help a lot.
Yeah, I think that's so good. And in Ayurveda, there's a very similar technique called abhyanga, which is a massage. And that's something that we sometimes talk about in our program. And it's very simple, like you said, like the things that work don't have to be complicated. You don't need special. So one thing that people can do that's an Ayurvedic technique is you take a little bit of oil, like rose oil or sesame oil, coconut oil, and you just gently, long strokes, very slow, long on the limbs. And it forces you to slow down, and you just like breathe through it. And that's very calming, soothing to the nervous system. And for people who have racing thoughts at night, it's often because we have not created any space to have rest during the day. So if you just create little pockets of time where there's no phone, no podcast, right? No TV, no email, just quiet silence, maybe go outside for a walk, or just sit and do some deep breathing for a few minutes, that gives your mind that rest. And these are the simple techniques that we have lost touch with in our modern world.
Like if they have like racing minds, but like now there's so much people, they don't exercise enough, and they've been sitting the whole day. And even we tell them like, probably you can do yoga, you can do some meditation, and they tell me like, well, meditation doesn't work with me. I usually tell them, okay, then do something more. You can do something in the afternoon or at night, or just after. You can go for like boxing, jiu-jitsu, whatever that can take your mind off of work, and then a little bit more active just to sweat it out. That could help you sleep much better. What do you think of that?
I think that's so good. It's such a good idea. And one thing that I started recommending to my patients as well, and I also do it for myself, on YouTube, there is a YouTube channel called Walk at Home. And it's like 15 or 30 minute at home walking exercise. And it's like a little bit of aerobic exercise. And if you cannot leave your house, because sometimes patients tell me, I don't have time to go anywhere. You can do it at home. Like put your YouTube video on, do it for like 10, 15 minutes.
Instead of just scrolling on TikTok or whatever.
And it has the advantage. I was just talking to my colleague who's an endocrinologist, and it has the advantage of bringing your blood sugar down. So for people who have pre-diabetes, diabetes, after each meal, if you do 5-10 minutes of walking, you can use the videos if you want. It can bring your blood sugar down by 20 to 30 milligrams per deciliter.
Does it need to be like a fast pace or just walk?
It's a moderate to brisk sort of, but not super fast. Like it can be like anyone can do it, 80 years old or 8 years old can do it.
That's really good advice. Yeah, it's cool. All right. So, thanks, Nishi. Thanks for telling us so much about like the sleeping rhythm and how your methods are, and talk about like with using the trackers. How do we look at that data? How do we really interpret these into our days? And yeah, really appreciate for your coming.
Thank you so much.
Thank you. Yeah. All right. Where should we find you if we would like to need your help?
Well, thank you so much for having me. And I think one thing I just would like to also leave the audience with is, if you're struggling with sleep, you don't have to suffer. Like help is available. There are people like you who can help with the acupuncture piece. There's sleep specialists out there who can help it. So don't wait. Don't hesitate to somebody. Yeah. We have a sleep program. It's an insomnia program. It's holistic. It's called Effortless Sleep. So you can find that on my website at pacificintegrativepsych.com. My practice is called Pacific Integrative
We're going to put it down here.
Great. Perfect. And then you can follow me on YouTube as well if you want to learn more.
Yeah, Dr. Nishi has so much YouTube videos that are really informative. And yeah, I learned a lot from that as well. Thank you so much again. Thank you. All right.